Welcome back. We're excited that you're here. Soon you're going to receive your report of findings and our recommendations for your care. There's a few terms that you're going to want to understand before going through this process. The first word that we'll use frequently is dysregulation, which simply is the lack of regulation, or to define it, an abnormality in the impairment or regulation of a metabolic, physiological, or psychological process. You can have dysregulation of a muscle, organ, gland, joint, nerve from physical, nutritional, or some sort of stress. Another critical word to understand is imbalance, which simply is the lack of balance or function. For example, you have two deltoid muscles. If one muscle is firing more than the other, it's going to fire abnormally or asymmetrically into the brain, kind of like having one light bulb out and one light bulb on. In order to fix that problem of it firing asymmetrically into the brain, which might result in a symptom of the shoulder or the arm or the neck, you're going to want to find the cause, which might be the bulb itself, for example the muscle, which is not too common. More commonly, you'll find it in the spine or in the brain itself. If you have dysregulation and/or inflammation, which often go hand in hand, there might be symptoms as well as a whole host of other problems. But then again, you might have no symptoms at all, which is why we're going to be thorough in our evaluation of these dysfunctions. Over time, if you have this dysregulation, subluxations in the spine, or imbalances, it can lead to some sort of degenerative process in your health or your joints. Then again, if we can correct the sources, you might not only be able to feel better now, you might be able to prevent problems in the future, you can slow down the aging process, and most importantly, have a better quality of life. And that's the type of care we specialize in here. Oftentimes, people think symptoms are bad. However, symptoms are very important, whereas they're not fun, but they're necessary to let you know that some sort of change is necessary. Kind of like if you put your hand on a hot stove. If you were not able to feel that pain and withdraw your hand, right, then you wouldn't be able to know what was happening until you smelled the smoke, and that obviously wouldn't be good. There's a common mindset out there in our country, and that's if you have pain, you're going to take a pill, and that mindset is very detrimental to our health. It's kind of like if your smoke alarm goes off, you pull the battery out rather than find the cause. Obviously, not a wise thing to do. So would it make sense to mask the pain or take a muscle relaxant, or discover the underlying cause and then learn ways to prevent that problem from returning? The answer is self-evident. Symptoms, they're just really the tip of the iceberg. Whether that be a physical, chemical, or some sort of mental stress that's the cause of the problem, it's going to lead to dysregulation, interference, eventually leading to symptoms and damage. Process. They have a symptom, unfortunately. And we're going to want to discover what our goals are after that. Do you just want to get out of pain? Do you want to get into a situation where it becomes stable and strengthened and get rid of the underlying causes so you get to feel good as well as have a better chance of preventing that problem? Or do you want to get as healthy as you possibly can be? It's kind of like if you liken it to having a toothache, and maybe that's come from too much eating sugar. So sugar plus time on your teeth is going to eventually erode away your enamel and destroy your teeth. So let's say you went a whole year without brushing your teeth, which is kind of gross to think about, Your dentist would be quite upset about this, and let's assume your dentist got everything cleaned up and you have your pearly whites back, and you do your daily brushing and flossing and get regular checkups. You have a better chance of preventing problems in the future. So to review, our intent is to help you correct the damage you already have by correcting the dysregulation and imbalances. Then, just as a dentist shows you how to brush and floss, we'll show you how to quit recreating the dysfunction in the future. Perform regular checkups to make sure your nervous system is free of these interferences, dysfunctions, and imbalances. We don't simply intend to relieve your pain or to hide or mask your symptoms. We do intend on correcting the cause. Remember an important thing, that symptoms are body signals and they're there for a good reason. And often just judging how somebody's doing by their symptomatic picture is going to be an extremely incomplete picture. If you go back to our 5 steps to health, and if you print out the one that you have or open the one that one of our staff team has given you, you can go ahead and write an arrow where you believe you are and read the text above it, but put an arrow. If you have a symptom and we know that there's some sort of inflammation going on in that area, you're going to want to go ahead and put an arrow where you are and go ahead and list some of the symptoms that you have. And then what you'll do is then decide where you want to be. Do you simply want to get out of pain, or do you want to become as healthy as you can be? And then what you'll do is you'll just write that in, figure out roughly how long you've had this problem, and then figure out, just take a guesstimate on what's a reasonable period of time of which you think this problem can go away. And then up at the top of the sheet, you won't have the circle, you'll just write one in yourself. On a scale of 1 to 10, simply put how important this is to you. How committed are you to getting rid of your problem and or being healthier, or whatever your goal is, whether that be weight loss, dealing with a thyroid issue, or a more simple shoulder or knee pain. 10 being most committed. Put where you want to be, and then put how committed you are to getting there. And then go ahead and write any potential roadblocks that you have, whether that be, I think I might not have the time or the finances to do this. Go ahead so we can discuss that and help you achieve your goal. So soon when we meet, we'll review your results and discuss your health goals. Together we're going to clarify exactly what you want, and I'll show you what to do to get there. So in this office you have choices. So if you simply want to get out of pain, if you want to be as healthy as you want to be, or somewhere in between, it's fine by us. Let's just clarify that so we can set an appropriate plan together. Thank you.